My name is James Allred. I am a dermatologist here at Graves Gilbert. So there's different types of skin cancers. The most common three cancers that we see in clinic are basal cell carcinomas, squamous cell carcinomas, and melanomas. Basal cell carcinomas and squamous cell carcinomas are often characterized by sores or almost pimples that don't go away. Maybe they start bleeding, they start scabbing, or have a thick crust, and they just don't follow the normal history of whenever we get a little bit of acne, for instance, and they'll stay for weeks to months to years and slowly get larger. And so if you ever see a sore that's not going away, that's pink, that's scaled or scabby, you'll want us to take a look at those. The other type of skin cancer that we commonly see is a melanoma, and those are usually the darker skin cancers. There's a special rule called the ABCDEs of melanoma, and the A stands for asymmetry, so a mole that appears asymmetric, that you can't take the sides of it and fold it together and create a perfect match, so that's asymmetry. Border is very similar, and that's for B for border, and if you see any kind of irregular border or a lopsided border. C is for color. And usually it's colors that you don't expect to see in a mole, like reds, whites, and blues. Those are potentially more dangerous. D is for diameter. Anything greater than about a 1/4 inch or 5 millimeters should get your attention. And the last one, E, stands for evolving. And that's potentially the most concerning feature, that if you just have a mole that's changing, that's maybe been the same for a really long time, but now has a new shape, a new sensation, is bleeding, that should prompt a visit to see us. I oftentimes add a U onto the end of the ABCDE. U's of melanoma. The U doesn't really fit with that mnemonic, but it stands for ugly duckling. If you just have a mole that looks totally different than all of its friends, then I generally like to spend extra close attention to that one, and it can be sometimes problematic, but not necessarily that case.